Hi, I'm Dr. Kelly Starrett with H-Wave, back talking about another case study that we have currently working with one of our high-level varsity athletes at a local university. This athlete has sort of recent history of some shoulder pain and is right in the middle of the season and is asked to try to manage this pain, but is a crucial member of the team. So one of the things that we're doing is saying, hey, when and where is this athlete going to be able to take charge of their shoulder pain? So they're seeking treatment, people are looking at it, but oftentimes rest and full sort of disability or kind of removing the athlete from the sport or the team really isn't the solution, especially when the athlete can continue to play and the pain isn't getting worse. So what we have is sort of a chronic condition where the athlete is under a little bit of discomfort, but doesn't seem to be progressing. And one of the things we decided was, well, maybe we're in a sort of a state where the tissues might benefit from some decongestion. And when and where are we going to put that decongestion in? So one of the things that's problematic is asking our athletes to engage in lots of non-exercise activity and move their shoulders around to decongest during the day, especially a student athlete. That athlete is using their shoulder big time in the sport and then is probably sitting around studying or walking, and there's very limited motion. So one of the things we discovered was that this athlete was comfortable using the low frequency setting, which gives us a sort of non-fatiguing muscle contraction in and around the shoulder girdle. And that athlete was able to start a decongestion program in the evening. When they got home, they could start pumping, and they discovered that they were actually able to sleep with the device. And so now we have a sort of a treatment strategy that's in the background while the athlete is doing nothing, while she's sleeping and recovering. And what's happening is her shoulder's starting to get better. It's starting to feel better. And one of the reasons is we're just working on getting non-threatening muscle contraction to the brain. It's okay for these muscles to fire and not have any sort of significant discomfort. And two, we're really doing a good job of staying ahead of chronic inflammation. That shoulder may be congested, and then the continuous workload is sort of continuing to congest that shoulder. And by pumping for 4 hours, 6 hours, 10 hours, what's able to do is sort of reset that level to zero. And over time, we're starting to see that athlete's pain attenuate. What we're trying to show you here is that there's lots of ways to integrate something like the H-Wave OTC into your practice working with well-bodied athletes. This athlete is not injured. This athlete is playing at high level, but we want to get ahead of that chronic pain and that persistent nagging low-grade discomfort that she has, because it limits her ability to generate force, and it's really not very pleasant. So adding in a little bit of decongestion on the margins of her day really gives her a lot of agency and control. And as she starts to feel better, that thing will start to resolve itself, and we can pull that H-wave out. But in the bottom line, we're looking at ways where we can move beyond just acute care or post-surgical care with this incredible device and start to see it as a high-performance additive or a high-performance driver, because our athletes who feel better, play better.